Hi, my name is Apolua and welcome back to I Am Positive. So today I just want to talk more about mother to child transmission, and that is one of the modes of transmission of HIV. If you've been following me on Instagram at I Am Positive 416, I did a short reel about different modes of transmission, right? And the reason I want to touch on this is because I feel like it's one of the most painful mode of transmission, where like the child is totally innocent of it, and then boom, they are born into this world with that kind of illness, or should I say that kind of condition. Is it? In 2022, there was a statistics that about 1.3 million women and girls living with HIV will get pregnant. And without intervention, 15 to 45% of these pregnant women or girls would transfer the virus to their babies. Now, there are three different modes by which this transmission is done: during pregnancy, through childbirth, and during the breastfeeding process. Okay. Mother to child transmission is also called MTCT for short. You're welcome. All right. So during pregnancy, the placenta infects the fetus. During childbirth, the blood of the mother will infect the baby, and during breastfeeding, it's breast milk. All right. Now, why exactly am I doing this video is to talk about the prevention of this virus. Bear in mind, I'm not a medical doctor or a medical practitioner. I studied microbiology in Obafemi Awolowo University. My final year project, coincidentally, when I didn't even know I was going to test positive to HIV, my final year project was about the prevalence of HIV/AIDS in Obafemi Awolowo campus. I know, right? Anyway, the best way is to know your HIV status. Like, that is the beginning of prevention. If you're single, looking to get married at some point and have children, which means you're going to be having unprotected sex, then it is important that from now you start getting your regular test done. And this is not limited to just HIV, okay? There are other kinds of sexually transmitted disease and infections that you can pass on to your fetus or your baby. All right. So apart from finding out what your HIV status is, if you feel like you're exposed to different modes of transmission of the virus, and you're looking to one day have your own child, birth your own child, it is very important that you get tested. See, if you don't even want to get tested for your own sake, do it because you know at some point you're going to have a child. So if you do it and you're negative, fine, continue to take precautions and continue to do your test regularly every 3 to 6 months. Now, if you are HIV positive, then you can start on your antiretroviral treatment immediately. If you start consistently like that, within 6 to 9 months, your viral load will be undetectable. And what that does is that it reduces the chances of infecting your fetus and your baby by less than 1%. So we go from about 45% to less than 1% of infection rates. Yes. And you can have a normal natural delivery, or you can have a cesarean section. Any which way, your medical practitioner will advise you on what best to do. Now, if you're a woman and you're getting married, or you're involved with somebody who is HIV positive, a man, that is, who is HIV positive, you also have to take precautions. Talk to your medical practitioner before you even start talking about pregnancy. And if you get pregnant by mistake, somehow, immediately get to the doctor and begin your treatment. I know 2 people or so who are HIV positive. They married HIV negative men. One has 2 children. Both of them are HIV positive. At least the last one. I was part of those people anticipating after the baby turned 18 months, because after 18 months, the baby is tested again to really confirm their HIV status. The other one has a baby, and the baby is also HIV negative. Okay, so this thing is possible. Just go on social media, go on Google, and you'll see a lot of couples, a lot of discordant couple that have children that are HIV negative the HIV positive mother carried the baby and the baby is fine. And even if it is the father that is HIV positive, the mother carries the baby and the baby is fine, all right? But it is very, very important that you take precautions. So this is the kind of transmission where you can't be reactive, you've got to be proactive. And by proactive, I mean be an adult. And by adult, I mean be a responsible grown-up. Do you understand? I mean, you shouldn't even be thinking about birthing a child or bringing a child into this world if you're not a responsible grown-up, honestly, right? And I'm not saying this to anybody who is sort of like a rape victim or you were abused and through that you got pregnant. No, I'm talking about normal circumstances here, okay? And even if that is your case, rape or whatever, it is very important that you get tested immediately so that you can start protecting your baby from the womb. I've met two people. One is a teenager, another one is a young adult that, you know, got infected by transmission from their mother, and it's not palatable. It's not palatable because you won't even know if you're to be angry, if you're to be pitiful. You know, it's a lot of emotions that will be going through their heads, and it's not just cool. So take responsibility and do the best thing. Be proactive about your health. Be proactive about your sexual health. Be proactive about the child that you're expecting. Take care of them from now when you're not even pregnant. Be conscious that you're going to be a mother, you're going to be a father, even if you're HIV positive, even if you're HIV negative. So what are the major takeaways from this video? Whether you're HIV positive or HIV negative, as long as you are going to be having sex and you're going to expect to get pregnant at some point, you've got to take your sexual health and your health generally serious. And what I mean by that is every 3 to 6 months, get tested. If you're HIV negative, continue to get tested. If you're HIV positive, get on your antiretroviral treatment, right? And be consistent with it so that you will greatly reduce the chances of infecting your baby. All right? Okay, bye guys, and thank you for watching. Ciao.